Now, from CBS News Miami, this is Facing South Florida with Jim Defede.
Welcome to Facing South Florida. I'm Jim Defede. We begin with a story that offers insight into just how broken Miami-Dade County government is. It's the sad tale of the Miami Center for Mental Health and Recovery. The county has spent more than $50 million to renovate this building. It's been ready for more than a year, and yet it remains empty and not helping anyone. The reason is infuriating, and I'll get to that in a moment, but you need to first understand what the center is intended to do. The idea is to take mentally ill individuals out of the jail and move them into a place where they can receive comprehensive treatment and support. Right now, we have a system where people with mental illnesses are arrested for homelessness or other minor drug charges. They then sit in jail for weeks or months at a time before getting released and then rearrested a short time later. It's a cycle that happens again and again. It's so bad that Judge Steve Leifman, who has been working on mental health issues for decades, has even been able to identify by name 1,000 mentally ill individuals who keep getting arrested and released and arrested again. If you look at just the top 5 people on that list, in the last 5 years, those 5 individuals alone were arrested 142 times and spent nearly 4,000 days in jail. And again, we're not talking about serious offenses. The reality is their crime is being mentally ill. This is not just an insane system, it is a cruel one. This center, the Center for Mental Health and Recovery, could break that cycle by getting them the specialized treatment the jail cannot and does not provide. It would also save the county millions of dollars in the process. Here is part of a conversation I had this week with Judge Leifman about that very fact. When an individual is in the county jail and they are mentally ill and they are receiving treatment, who pays for that treatment?
The county, 100%.
So county taxpayers pay for the individual who's being treated in the county jail.
Yes, and so a mental health bed is more expensive than a regular jail bed.
Okay. When that person is moved from the jail into this facility that has been waiting to be open for more than a year, when they are in this facility, who pays for the treatment when they're in that facility?
It gets blended. So you will have Medicaid dollars, you will have insurance dollars, because when they're in jail, there's no Medicaid, no Medicare, and no insurance. So number one is you immediately reduce the burden by applying those Medicaid dollars. Also, the state will be paying a significant portion of the crisis stabilization and maybe some of the other short-term residential beds. So it begins to reduce the burden on the county taxpayer significantly. But there's another piece that everybody forgets about, and it's where they're the most expensive. Mental health treatment isn't cheap, but it's not out of control. The real cost for this population is they all have very serious primary health issues. And there's a really interesting reason, and it's because they all smoke. One of the side effects of having psychosis is it depletes your dopamine levels. And it turns out nicotine stimulates cognition, which stimulates dopamine. And so this population self-medicates with cigarettes, and they chain smoke. And so when they go to jail, they have heart disease, cancer, and diabetes. Again, the taxpayer is paying 100% of that cost. The second they move into the building, we've already reached an arrangement with Camillus Health, which is a federally qualified healthcare entity. They will put a satellite in the building. They will bill Medicaid directly. That is a huge savings to the county taxpayer immediately.
Do you have an estimate on how much money the county will save by transferring just those medical costs, whether it's the medical costs or the mental health care costs, shifting it from the county to other entities, whether it's Medicare, Medicaid, whoever, private insurance, whatever is coming in? Do you know how much money is projected to be saved on an annual basis?
I can tell you this. The Boston Consulting Group, which is one of the largest national consulting or international consulting firms in the country, did a pro bono business plan for us. And they determined that after 3 years, the building pays for itself. Now we know that top 1,000 I was referring to before, They spent 317,000 days in psychiatric beds in the jail. They cost $117 million, over 5 years. That's a lot of money. And so you can do the math, and it starts to add up quite quickly in terms of actual savings. But even if it's not savings, why do you want to keep taking the same people and allowing them to cycle through jail, commit crimes, possibly commit a violent crime, be homeless, be in a hospital, when we can get them into treatment, help them get into recovery, and break this horrible cycle that's affecting everywhere in the United States? Miami-Dade has the opportunity to be the first community in the country to actually fix one of the most complex problems an urban community has. And in this case, it actually saves money, saves the county money, and pays for itself relatively quickly. So,
Well, and we're not even talking about the humanity of it.
right.
Actually trying to care for people.
We wouldn't do this if they had cancer or heart disease. I mean, that's what's so striking to me. Why are they different? They didn't ask to have schizophrenia or bipolar disorder. Trust me, it's a cruel illness. And the reason we're stuck with this problem is not the county's fault. This is a national crisis. And it's because when community mental health was designed in the United States, the most severely ill with the psychotic disorders were still in state hospitals. And so community mental health was designed for people with moderate mental illnesses, not the acute ones. And when we shut down the hospitals and we massively cut housing and we went to the war on drugs and crime, this population got thrown into communities like ours that was not built for them. And instead of them building a system for them, we started to arrest them, and that's what's happened. We actually have an answer. We are way ahead of the game. We should be really proud of what we've been able to accomplish. This is the final, gem in the crown to fix a really massive problem. We only have about 1,000 homeless people left in Dade County. And it's the same 1,000 that's on the list that keep going back and forth to jail. The businesses are tired of it. People that live in downtown are tired of it. Family members are sick that they can't get their loved ones access to treatment because it doesn't exist. And the taxpayers recognize this. They were again way ahead of the politicians. They overwhelmingly voted to make this happen. And so I don't know why a bunch of elected politicians want to defer what the voters have asked to do.
By the way, just remind me, when was that vote?
2004.
I'm sorry, did you say 2004?
Yep.
22 years ago, the voters voted to have this taken care of. This facility was built and has been ready to open for how long?
Over a year.
And how much does it cost on an annual basis to have an empty building just sit there?
It's $1 million a year that we're paying in taxpayer dollars to keep it empty. Why we let these people who are really just sick cycle between homelessness and jail and hospitalization when we could actually give them an opportunity to recover. It's sick and it's cruel and none of it makes sense. And then when this report came out, it just made it that much more sickening.
So what sickening report is Judge Leifman referring to? Well, it turns out that even though the county went through a competitive process 2 years ago and selected 2 nonprofit groups to run the center and get the doors open, we now find out that sometime last fall, a for-profit company out of Nashville, Recovery Solutions, secretly sent a proposal to Mayor Daniella Levine Cava saying they wanted to take over the building. They even hired big-time lobbying firm, the Southern Group, and lobbyist Oscar Brainin. And guess what? After Recovery Solutions and their lobbyists went to work behind the scenes at the County Commission, the final approval Leifman needed to open the center started getting bogged down in one commission committee after another. The only reason the public learned about this secret proposal from the Recovery Solutions team was thanks to reporting by the Miami Herald 2 weeks ago. The mayor never informed Judge Leifman or County Commissioner Raquel Regalado, who was working with Judge Leifman to get the center open, that there was another proposal floating around. A proposal, by the way, that would cost the county more money and help fewer people. Now, I spoke to Mayor Cava about what was happening.
Well, first, I want to be very clear that I came into office as mayor and learned that this project had been stalled. I immediately got to work to make sure we could finish the construction. I also made sure to meet with all the stakeholders, and finally, we have a path to open this facility with two vendors that, after an open process, we resolved were the best, in conjunction with the sponsor, who became Commissioner Regalado, and with Judge Leifman. So we negotiated at the direction of the board with these two vendors. We have a contract ready to go. We've been waiting for this to go forward, and it needs to go forward. We just can't delay any longer on something that was promised to the public and where we have a solid plan. Not only did I mention to you that I was the first administrator to take this under serious consideration and move it forward, but I also had to find the funding, which was not easy because the original item did not contemplate operational costs. And so that was a source of concern, how we were going to fund it. And we were able to secure a number of different funding sources that allowed us to do a 2-year pilot, which I think is the proper path forward. So when this, I would say, incomplete proposal was received, and it was, and the conversation happened with our director, who's responsible for this kind of service, it wasn't considered a complete proposal. So we did not act upon it. We were already well underway with the plan that we had been directed to follow.
And did you let Commissioner Regalado, who was taking the lead on it, or Judge Leifman know that this for-profit company was in touch with your office about taking over the space?
Jim, I think you might not realize this, but we get contacted by hundreds of vendors every day for all sorts of things. We provided a courtesy meeting with our director. It was not appropriate to proceed at that time. It wasn't complete, and we already were well underway with the proposal that we'd been directed and we had selected to proceed. So we don't, that's my administrative duty. It was not it was not in the best interest of the county. And I will point out that there was no further follow-up. It was not a formal proposal.
And I do want to move on to why you are advocating for the commission to move forward. But I just want to be clear about this. You had a courtesy meeting, you said, with the principals for Recovery Solutions.
The director right? Of the department had of course, I wouldn't call it courtesy. It was, we received lots of proposals for lots of things that people think could benefit the public, and they would like to contract with us. And that's part of routine business.
Did you meet with their lobbyist, Oscar Brainin?
I did not directly meet on this proposal. So
did you
I was
have conversations with Oscar Brainin?
I was informed about it, and I did not have a direct meeting about this proposal because it was not complete.
But again, I'm just asking, did you have any conversations with Oscar Brainin about this?
Not. All I know is that this did not move forward, and I was informed that it had not moved forward. So the fact that it is now the subject of so much interest is something that is a surprise to me. On the other hand, if the commission determines that they don't want to go forward with a proposal that we crafted so carefully, so deliberately, based on my knowledge as a social worker and a public interest lawyer. I've worked directly with these populations over decades: homeless, mentally ill, and those incarcerated individuals. This is my background, of course. So I did not, this was really a good proposal. It took us a long time to get to it. We are very eager to move this proposal forward.
Right. And again, but I do want to try to have a direct answer. Did you have a conversation with lobbyist Oscar Brainin about Recovery Solutions?
The only thing was in passing, and that it hadn't moved forward. That was my understanding. This has taken a very long time to get to the commission, as you know. Now, why is that? Because there were a lot of different opinions on the part of different commissioners about what should happen with this facility. I had to navigate that. I had to secure enough support to move it forward, right? I had to urge its placement on agendas, and I am urging once again that it not be deferred and that it move forward. Should the commission decide that they don't want to go with secure funding for 2 years for a pilot, and they want to delay the process further to explore other options, obviously, that is what we'll do. I am supporting the proposal that I developed.
And what can you do to try to move this along other than just expressing your support for it?
Well, I hope with your help that they will understand that there should be no confusion any longer. That we are not in a quandary. We have a legitimate proposal and it needs to move forward.
What we don't know is how many county commissioners were given the secret proposal from Recovery Solutions, or if they have been lobbied to slow down the opening so that this for-profit company, or perhaps some other group we don't even know about, can come along and take control of this building. But while the county commission, under the leadership of Chairman Anthony Rodriguez, continues to drag its feet, the building will remain empty. And because of that, there are people across our community with mental illnesses who will continue to suffer. And that is indeed sickening. When we come back, we'll talk with the new state representative for Mar-a-Lago, Emily Gregory. Stay with us. Welcome back. Emily Gregory is the newest state representative in the Florida House, winning a special election on Tuesday that saw her flip a heavily Republican district blue. Her opponent not only received the endorsement of Donald Trump, but the president voted for him because that district includes Mar-a-Lago. After her win, she received congratulatory phone calls from Democrats across the country, including former President Joe Biden. I spoke to her late last week. What has this week been like for you since the election on Tuesday?
It's been a little overwhelming, surreal, but exciting. I mean, this is what we worked so hard for, and I'm so grateful and honored that the voters of District 87 entrust me with this important responsibility.
Why did you run? Why did you get into this race to begin with?
I felt that the leadership in Tallahassee and the legislature was not listening to us. I felt that they were very distracted on culture war issues and not solving the very real affordability issues that us average Floridians are struggling with, like property insurance and healthcare and education. And that is the only reason that I'm interested in running, is trying to find solutions to these big affordability issues.
So when you get in the race, are you thinking that you're running as a way of trying to at least raise these issues? How honestly, what kind of a chance did you give yourself when you set out on this campaign?
Well, Jim, I must have a fairly sized ego, because I absolutely thought I could win the whole time. And I was also naive, right? Like I had never been involved in campaigns or any of it. So I just believe that I'm very embedded in my community and that my neighbors, regardless of their political affiliation, that we see the vast majority of issues very similarly, and that there are solutions that we would all, be happier with those outcomes, and with lower property insurance premiums, with more affordable, more accessible healthcare, and with strengthened public schools.
It's interesting because obviously you're getting so much attention now because your House district includes Mar-a-Lago and its very famous resident, President Donald Trump. But you really didn't make this campaign ever about Donald Trump. Talk to me about how you navigated that part of what you were doing, because the president did come out and endorse your Republican opponent, made a big point of saying that he voted by mail, all those sorts of things. But yet you sort of steered clear of the Donald Trump of it all. Tell me why.
Yeah, sort of in the same way that I stay grounded in the data and in the real issues. That's what I'm interested in doing in the state legislature, is staying true to the constituents, all 180,000 residents of District 87. That's my boss. That's who I serve. Not the most famous resident. It's also includes West Palm and Palm Beach, so I think there actually are quite a lot of famous residents. One of them is the president, but none of them are any special constituents. All constituents are equal, and I want to serve the greatest number of the greatest good with good policy.
And certainly the one person in your district who doesn't have to worry about health care is Donald Trump. He gets excellent health care, as opposed to probably some folks in your district who are struggling to make sure they have the health care they need, correct?
Right, yes. I mean, all of those that were on ACA had those ACA tax credits. We see thousands of our neighbors having to make a horrible choice whether to cancel their health insurance or buy groceries for their families. So that is my priority, is solving those kind of issues. And then, I mean, if we can bring property insurance premiums down, which I know we can with good policy, I mean, that would impact the president. That would help us all.
You said you heard from both friends of yours who are Republicans and Democrats that you should run. Why did you decide to run as a Democrat, knowing that you were entering a legislature now that will be, still dominated, still with a supermajority of Republicans in the House?
Well, I am a Democrat. I'm a lifelong Democrat. That is my worldview. But what I see in my personal life, and I hope to foster more of it in Tallahassee, is not a blindness to partisanship. It's about finding common ground and putting the biggest solutions and biggest problems first and tackling them together. And I think we're going to be able to do that. I feel very hopeful. People told me that I could not, in no way, ever win this seat. And Jim, I did. So.
But what is it internally that made you want to persevere on a case like this and move forward?
I just think the stakes are very high, right? I have 3 young boys, and I want to leave a kinder, fairer Florida that works for all of us, for them and for me and for all of us. I think that when good people stay on the sidelines and don't take action, then the world stays the same. So I'm incredibly proud and so grateful of all of my neighbors that have gotten engaged on the campaign. We've trained almost, I think, 200 canvassers, people to knock doors and to, let people know that there is a special election and to talk about our issues. And these are people that for the most part, were not engaged and were not, wouldn't necessarily consider themselves politically active. But I think a lot of us are feeling like we have to change things, and that change starts with us.
There is that perception that discourages a lot of people from running for office, believing that if you don't have big money donors, if you don't have political action committees or others sort of financing your campaign, that you shouldn't even try, that you shouldn't get involved. And you're proof that that's not true. What advice would you give to others out there thinking of running?
So that's exactly right. I was just going to say, well, I should be I'm in at least one, um, um, contrary piece of evidence to that theory. And I think you have to do some soul searching, knowing that this will probably be the hardest thing you ever do. I can't undersell that. It was all consuming. If my family hadn't been on board, my husband took over primary caregiving duties for months and months, and that piece was integral. And then you just believe in yourself. Like, it started with me, myself, my husband, and a couple friends sitting around a kitchen table being like, what if we just try? Like, what if we just do it? Like, if we don't like what we're seeing out of the State House, what if we just give it our best shot? And I think that's the only way the world's ever changed, is a small group of people who were dedicated and passionate. And it's one of my favorite quotes from Margaret Mead. And that's the only thing that's ever changed the world. So we just did the thing.
We'll be right back. Well, that's all the time we have today. If you have any thoughts or comments, feel free to contact me at jdefede@cbs.com. Oh, I do enjoy hearing from you. Thanks again for watching. Enjoy the rest of your day.